So it should pop up.
Or 1:30? I've got
Nobody approved the plan.
Yeah, that was delayed because you just walked by the screen. There are
Did you already?
It is delayed because you walked by.
It should be routine.
And I probably will.
You goes first.
Just leave it on there, Steve, because there are other supposedly.
Good afternoon.
Good afternoon.
Welcome one and all. Thank you all for coming out today to our public hearing for our fiscal year 2020 area plan. I'll be explaining a little bit more about the area plan today. I am Steve Zollos. I'm the CEO here at Senior Services of Southeastern Virginia. I've been the CEO here since August 1st of last year. I was the Chief Operating Officer here before that. So I have about a year under my belt as the CEO. And this is the year, every 3 years, we are required to start from scratch and build a new 3-year area plan, which is really, you can look at it as our strategic plan for the next 3 years. So I'm going to walk through that plan with you all, and I'm hoping that we're going to have a little bit of a conversation after the presentation to talk about what you see in the senior community. If you think we're missing something that should be on our agenda, or if you think we're hitting something a little softer than we should, we need to hear those things, because this is the opportunity for the public, and both in the private sector as well as the general public, to be able to come and speak into our planning and our priorities and help us set a really strong area plan for the next 3 years. I want to start by introducing a few folks. Drew Lumpkin, the Regional Director with U.S. Senator Mark Warner's office is here. Thank you for coming, and thank you for your support throughout the year. We meet with Drew and his team and the Senator at every opportunity, keep them informed as to what we're doing, and hear from them as well. And Diane Kaufman, the Regional Director for Eastern Virginia for the Office of U.S. Senator Tim Kaine. Diane, thank you for being here and keeping up with us as well. It's very important to us that you hear the things that we're hearing from the community and kind of feel the necessity of the services that we provide. So thank you for being here. I also want to recognize we're on Facebook Live this year. So we have folks from one of our senior centers on board watching, and they will be able to chat their questions in, and that Debbie will relay those questions to us. Also, Ann Williams from the Hayden Village Center. I'm going to explain a little bit about the Hayden Village Center this afternoon as well. It's a really unique and cool project that we have going that's going to be opening this year. So thank everybody for joining us. I'd also like to thank our staff. I have a number of our directors here for transit, wellness, finance, HR, etc. Be able to come, and if there's questions that we need support on answering. But these are the folks that have really helped to build the area plan for us this year. So
we also have Southside Baptist Church seniors just weighed in to say hello. They're listening.
Southside Baptist Church, welcome. Glad you're here. Okay. And with that, I'm going to just start right into the presentation. I want to be faithful to our time. I know that Drew needs to leave at 1:30 or so I'm going to try and get to as much as I can up front. Please, If you have thoughts, questions, go ahead and write them down so you don't forget by the end of the time to ask those questions. Like I said, they're very important to us. You folks on Facebook Live, please chat those over to Debbie. She'll make sure that those questions get asked as well. So as I mentioned, we're talking about our 2020 Area Plan for Aging Services. I wanted to give you just a quick rundown of how things generally work. We're part of the National Aging Network. There's one federal agency, ACL, Administration for Community Living. And that breaks down into the 50 state units on aging. Our unit here in Virginia is called Department of Aging and Rehabilitative Services, DARS for short. Then there's 622 AAAs, areas, agencies on aging across the United States, and we're one of those. Of those 622, 55% are government run, somehow tied into the government itself. 39% are private nonprofit organizations, and 6% are pretty much hybrids, something in between, maybe a little bit of both. Your area agency on aging, which is Senior Services of Southeastern Virginia. We were established in 1972 as an independent 501c3 not-for-profit organization. We were the 4th area agency on aging in the United States. So we have a long history, and we have a legal designation by both the federal and the state governments as being a qualified area agency on aging. For our particular organization, currently we have 93 people part of our staff. That does not include volunteers. 56 are full-time, 37 are part-time, 75 are female, 74% are minority, 51% are over the age of 55. So we walk the talk. All right. And again, we're talking about our fiscal year 2020 budget of $7.2 million. Again, who are we? Here's the area that we cover. All the way from Norfolk, Virginia Beach, Portsmouth, all the way out to Isle of Wight, Southampton, Franklin, Suffolk. So if you think about it, and the way that we here at Senior Services have to think about it, we have pretty complex metropolitan areas. And then as we move west, we get more and more rural. It's really a whole different mindset when you're talking about serving people in an area like Norfolk versus areas out in Southampton and Franklin, where it's very rural, a different methodology for accessing the services that are needed. So we wear a couple of different hats in that vein. So we have 8 jurisdictions overall, covering over 2,000 square miles. And that becomes very significant if you're Donnie Perry, who runs our transit program. How do you take our vans and limited resources for transportation and provide the most effective transportation programming over that vast area? It's not easy. The purpose of the public hearings. First is to present our priorities that we have so far thought of via our directors and input from the community, input from our Service Advisory Council members to set a plan in place. And then it's an opportunity for professional and public input on the needs of seniors and caregivers. So I want to make sure that we understand we're not just talking about seniors when we talk about Seniors Services of Southeastern Virginia. We're talking about seniors and those folks who care for seniors, whether you're family, whether you're a provider, or whether you're a neighbor who helps out. Ultimately, we want to gather people here today so that we can develop an effective set of priorities for the coming 3 years. So your input is important today. Now, to give you the overarching vision, mission, and values that we have here. First, our vision is to develop a community that empowers, respects, and values seniors and their caregivers. Right? Empowers, respects, and values. Our mission, according to that vision, is to provide seniors and their caregivers with access to programs and services so they can live with choice and dignity in their communities. Okay? Again, I'm going to pick out a couple key words here: choice and dignity. This doesn't always happen for seniors. Our value proposition: we are our community's personalized one-stop resource for senior services. Our hope and anticipation is that when a caregiver or a senior doesn't know where to turn, they know there's one place they can call. That's senior services. Whether they need home health services, whether they have security issues, whether they need personal care, or they're a caregiver who just doesn't know if they're doing the best they should be doing for their loved one. We want them to feel like they can call us. We don't provide the services directly. We either connect them directly to people that do provide those services, or we, if they prefer, give them the information so they can connect with those services. We want to make it easy for the seniors in our neighborhoods and communities. Our strategic priorities: first, maintain the viability of financial growth and quality and relevance of our services. Be the primary resource to aging adults and their caregivers. We want to be recognized thought leaders for senior services. I work with national organizations, I work with state organizations. Our staff go to national conferences, they get trained internally, and bringing those resources and information to the front of the field so that our community understands here is a place where we're keeping track of the trends, we understand the community, and we're implementing the key services that the community needs. So that's what we're talking about when we're talking about being the thought leaders. If you need information on trending, if you need information on what services are available across the country and what we're bringing here and when, those should be the first place you think of. Should be, let's call senior services and find out that information. And then expand strategic partnerships. I mentioned I'm going to talk a little bit more in a minute about Hayden Village Center. We're working with, I just recently met with PACE program for Centera, met with the food bank. We're working with the public schools for providing meals as well as intergenerational programming. We recognize we can't do everything on our own that's needed in our communities. But if we leverage what we do and we partner with other people, we can have the maximum impact. I like to say that we go to communities and organizations, and we're trying to find people. We're trying to find people who are doing good in the community, and we want to empower them to succeed. So it's not just all about us. It's about leveraging the good people that are out in the neighborhoods and the communities, and bringing the resources to bear that will help them succeed in what they're doing. Okay, we get down to our strategic goals. Maintain, grow, and improve access to programs and services that are relevant to the needs of a diverse population. This is a little bit of a complex strategic goal if you think about it. Just the idea of a diverse population has changed in the last 5 and 10 years. A diverse population goes much further than race today than it did in the past, right? So we have to look and say, how do we meet the needs of all the different groups of people? How can we be as inclusive as possible with the resources that we have? So we want to provide the access to the programs and services that are needed, and we want to make sure they get out to the widest variety of people that we can. Strategic goal 2. Improve the effectiveness of the staff, volunteers, and board of directors to maintain day-to-day efficiencies as well as effective corporate governance. So this is more of an internal goal. And this goes back to what's our team learning and what are they bringing to bear and bringing out to the community because we need them to be effective. I'm going to go over a little bit of finances in a little bit. And this past year, our team has really been focused on how do we, with a given amount of money, serve as many people as effectively as possible. What can we do better, smarter, that will help us stretch our services and get them to more people, because the resources we have cannot get to everybody that needs them, clearly. And those of you who are in the room that are part of this network of helping seniors understand exactly what I'm talking about. Strategic goal 3, ensure that senior services impact is sustainable over the long term. We've got the Hayden Village Center opening up. It has financial impacts on our organization. Part of our job here is to make sure that we are able to maintain and grow Hayden so that it doesn't become a financial burden on the organization. So that's one of the things that we're doing.
Tanya, we have Tanya Canty from Mission United is out there, and she's asking if you could please read what's on there because they're having a hard time seeing it on this phone.
Okay.
I'm sorry to interrupt.
Thank you. Strategic goal 3 is ensure that senior services impact is sustainable over the long term. That's the goal number 3 and what I was just explaining about. Now let's take a quick look at our population. Southampton Road's 60+ population, 205,000 individuals are 60 years old and older. 35,726 are 65+ veterans. And 33,000 65+ individuals live alone. I want us to think about that one for a minute. Right here in our community, we have 33,000 seniors who are 65 and older living alone. And start to think in your minds, what's the implications of that? What does it mean to be 70, 75, 80 years old, living at home? We're going to talk about the social determinants of health in a minute. And it plays right into this. This is a big need in our community. This shows a serious need for services, and I'll show you why. A little bit more about the population. About 50-50, 60+ population, about 50-50, female, male. White, 57%, black, 33%, Latino, 6%, Asian, 4%, give or take. Now, in 2018, the population was 205,597. In 2030, it's projected to be 304,412. That's a growth rate of 48%. A growth rate of 48% is phenomenal. In 2020, it's expected that for the first time, the age range 19 and under will be less than the age range of 65+. Think about that. And I want you to think about this. As I've been going around for the past year, like I said, I've been the CEO here for a year now. I go to the Board of Supervisors meetings, I go to the City Council meetings when they're talking about their budgets, and I talk to them about seniors and why we need allocations from the local governments. I don't think everybody gets it just yet. Okay, 15 years ago, I was working with the local health system, and we were looking at the population curves, and we said, oh my gosh, we need to start planning for this. You know why? In 10 years, look what's going to happen. And we started to plan, we started to build programming, etc. But most of the people now don't realize where we were 15 years ago, looking out and saying, oh my gosh, it's coming, it's here. Okay, that's what this is showing us. It's here right now. Our funding, and I'll go into this a little bit more, but our funding pretty much from federal and state governments remains flat over the years. Maybe a little increase. Okay, but primarily it's pretty flat. Same thing with our localities, funding from the localities. And we also operate with grants. And the grants are at best flat for providing dollars for seniors. So if you bear with me, if this is our line for funding, and it's like this, but here's our line for population growth at 48% is like this. This gap in between, that's the growing need for seniors in our community. Not across the country, not in Los Angeles, right here in Hampton Roads. And every year that the funding for programs like ours stay flat, the gap increases. Okay? And the population proves that out. We're going into the next census. It's going to show, without a doubt, that these projections are accurate. Okay, 60 plus people in our community who are in poverty. Franklin, 12%, Norfolk, 12%, Southampton County, 11%, Portsmouth, 10%, Suffolk, 9%. It would be bad enough if they were all 5%. They're not. So we've got a lot of people in need, and as that population continues to grow, this need is going to grow. These percentages are going to grow. Okay, improving population health. I'm going to jar our brains a little bit right now, because we're going to start talking about the social determinants of health. What makes up a healthy person? This is from the Healthy Living Center of Excellence. And they came up and they said, look, 10% of your health is dependent upon your genes and biology. Basically, were you born a healthy person? Are you generally healthy, or are you sort of sickly? Okay? 10% of overall health of people is based on their genes and biology. This might be a surprise. 10% of your health is dependent upon clinical care. I got to get to the doctor. I broke my arm. I got to get it set. I got to get to the hospital. Can I get to the hospital? Can I get my arm set? Am I okay? Okay, 10% of your health is dependent upon that. Now, social and economic factors. 40%. What? 40%. And I'm going to draw this to a senior so that we get an understanding. Okay? Social and economic factors. I'm one of those 70-year-olds who are living alone. And my pool of friends has diminished over the years. Suddenly, I'm finding myself isolated. Suddenly, I've never been depressed before in my life. But now I'm depressed. And now I'm not eating right. So now my nutrition is going down. I'm not even going to talk about the rate of senior suicides. Okay. But that's where this area, one of the areas that this social and economic factors goes to, 40%. Physical environment, 10% of your health is dependent on your physical environment. Again, let me draw it to seniors. I eat 3 square meals a day. But when you go into the refrigerator, all you find is a quart of milk and Fruit Loops in the cupboard. Yeah, I eat 3 times a day, but I eat cereal 3 times a day. You know why? I can't use the stove, and I can't get out to the grocery store anymore. So now we're looking and saying, you know what? Physical environment, I've got, my gait isn't as good. I don't walk as good as I used to. But you know what? I still have to go up a flight of steps to get to my bedroom. And by the way, I have throw rugs on the floor, which increases the likelihood of a fall, which increases the likelihood of a hip fracture, which dramatically increases the possibility of death. Okay? So, physical environment for a senior, it's huge. Health behaviors. All right, usually we think of health behaviors, we say smoking, physical exercise, very important, no question. But when we talk about seniors, health behaviors, I'll go back to the milk in the refrigerator. Okay? Yeah, I'm eating, but I'm not really eating. Okay? So you start to understand, as you look at improving population health, this 40, 50, 60, 70, 80% is really what I label as the social determinants of health. This 80%. This is what senior services does. This is what happens when we send an options counselor out to somebody's home to help them analyze what's going on and what their needs are. This is what happens when we arrange for Meals on Wheels to go to people's homes to make sure they're not eating cereal 3 times a day and they're actually getting nutritious meals on a regular basis. These are the types of things that we do. This part that impacts 80% of a person's health. In my opinion, we're an essential part of the healthcare system. We're not recognized that way yet, but we should be. And I'm going to start preaching it because that's the truth of it. Okay, so what are some of the services? I'm not going to go through all the services that we do. I'm going to hit on a few of them. But I want you to keep thinking about the social determinants of health and those 80% areas that help somebody stay independent with choice and dignity in their communities. All right. Aging Disability Resource Center, our center for aging, basically. Care transitions. A senior comes out of the hospital. We meet them at their home. We make sure they can be compliant with their medical directions. We make sure their home is physically set up in a way that will help them succeed. The goal of care transitions is stop those folks who are coming back to the hospital within 30 days of discharge because they haven't been able to do what they were supposed to do when they got at home. Not by anything of their fault. They're just older, right? So our care transitions program has seen a reduction from folks, the average without care transition coaching when they get home, 18% readmission rate. With coaching, 8 to 10%. Does it work? Absolutely it works. No question. We had numbers of grants for that program to help us do it for a number of years to prove it out. The difficulty where we have is transitioning from a grant to being paid so that we can cover the cost of our coaches to go out and do this work. Right? Now all of a sudden, we're not so sure, healthcare systems aren't so sure they really need this. They need it. Well, they don't need it. Their clients need it. That's what we're here for. Communication, referral, and information. That's the one-stop shop. That's call us. Let us direct you. We don't care if we do the services or not. Let us help you. We just want to help. We want to make it easy for you to care for that senior or to be that senior who wants to live with choice and dignity. Elder abuse prevention, legal services, ombudsman's programming, options counseling, community education. We help with the advanced care planning. We do our annual Art of Healthy Aging every year just to get information out to the community. In-home stabilization. Bob Batcher's here. We assist with adult daycare services at the M.E. Cox Center in Virginia Beach. We do transportation. We bring meals out to the Prime Plus program and other programs. Meals on Wheels, homemaker, personal care, respite care, senior companions. Senior companions can sound like fluff because it's basically matching seniors up with other seniors with similar likes, so that someone can come to your home if you can't get out, or if you can't drive, someone who likes to drive and can take you to the store and shopping because that's just what you like to do. Or someone who likes to play cards because, you know what, I've always played cards. I don't have anyone to play cards with anymore. And you know what? A companion will come in, play cards, talk, make sure you eat, that kind of thing. Very important program. Difficult to get funding for it. Counseling and application assistance. Well, you can see the list: veterans benefits, Social Security, Medicare counseling, energy assistance, etc. 3 more areas: planning and advocacy. I'm involved in 3 Livable Communities initiatives, one on a statewide level, 2 here on local levels. Who can guess what the main 3 things that come up when we analyze the communities and we start talking to people? What are the 3 things that come up repeatedly that are needs in our community? Affordable housing, number 1. Transportation, number 2. Number 3, someone was talking to me about it before. You remember? Number 3, communication as to what's already available to them that they just don't know about. A lot of stuff we're doing, we just have to let people know about it. Okay, transit. Adult daycare, transit, iRide. We do fixed routes just like HRT, where we have buses that go every hour or so and you can rely on them being in your area so you can pick up a ride and get to places. In Western Tidewater, in Isle of Wight, Franklin, we're the only public transportation they have. And so we're trying to find funding to be able to expand our transit programming so that we can serve those populations effectively. If you think about the rural populations, how hard is it? How much harder is it for them to be able to get out of their house and get somewhere, to find someone that's willing to either pick them up or get them at a location that's available, than it would be if they were at Town Center in Virginia Beach, right? Pick up an Uber if you need to. Not so in Isle of Wight. All right. Okay, so we've got all different things in transit, and then wellness centers. Shelby's here has done a fabulous job of kind of recentering our wellness programming, our congregate sites, changing from boxed meals basically whenever possible to what do you call them?
We call family style,
Family style. Thank you. Family style meals. Still good food, but the presentation is vastly different. And if you need to sit down in front of a meal, it should at least look good, right? So that's part of what we've been doing, because people like Shelby and our team care about the people, not just the service. Right? So we like to keep a perspective and say, you know, someone sitting down for a meal is my mother. Am I going to sit my mother in front of this meal 5 days a week? Now we have limitations, because we got a lot of meals to serve and not a lot of dollars to spend. So we can't go spend $20 a meal. But with what we have, we're going to do the best that we possibly can. So we have education courses like diabetes self-management, enhanced fitness, home meds programming, matter of balance, falls prevention programming that we not only do ourselves in the community, but we train other people to do these programs so that we don't have to be limited by, gee, we got 2 people, how many classes can we do? No, now we've got 22 people and they can all train, and we can get more people taking care of their balance issues than if we tried to do it ourselves. Okay, new services in 2019/2020. Veterans Directed Care Services. This is a great program. This is for veterans who are at risk of going to nursing homes, but have the ability to care for themselves if they have the resources. So the VA has built this program to say, look, if someone qualifies, we can send an options counselor out to their home and help them figure out how to allocate their resources. We don't allocate them for them. We just help them do the analysis. You need home health, you need personal care, you need ABC. Here's your options. Now, veteran and or caregivers, you're going to hire whoever you want. It's a great program. The veterans love it. The difficulty is we work with the Hampton VA. The Hampton VA has not taken hold of this in the way that they ought. But we have no leverage to say, serve these folks in our community better. So, to date, we have one referral. The Hampton VA has only allocated very little dollars to this type of program. Now, McGuire Center up north, they've taken hold of it pretty liberally and have provided our associate organization, Bay Aging, with a large number of referrals. But we have to find a way, or we have to be patient until the Hampton VA comes to grips with it and figures out how they can do it here locally. But we have our foot in the water. Affordable senior housing, Hayden Village.
And then pay for it.
And then pay for it. I knew that would come from you. Hayden Village Center. This is a historic renovation of the Hayden High School in Franklin, Virginia. And we are getting ready to open that school in September. It has been made into 28 independent senior living apartments. It will also house our Western Tidewater offices. So we're consolidating some of the work that we've done there. And it also has Southampton Memorial Hospital has leased space from us and is starting a primary care office in that locality. And there is no primary care or medical offices in that part of town. So it'll be the only one of its kind there. Our transportation will be hubbed out of that. It'll be a real opportunity for folks in that neck of the woods to be able to say, I really want to age in place. I don't want to leave my community. My house is too big. My living situation isn't right. I can come to Hayden Village Center. If I can't drive in a year, 2 years, 3 years, the buses come right there. If I need medical attention, the medical office is right there. I have access to the community, etc. So it's Hayden Village Center. Should be opening in September, yes.
So Tanya Conti from Mission United is asking how they can help get the word out and support our program for Veterans Directed Care Services.
Oh, that's a really good question. Tanya, I will be in contact with you about how you can assist. It's a little bit of a complexity trying to work with the VA, but we definitely want to team up. We definitely want you to know about the details of this program and how we can leverage each other's help. Adult daycare services at M.E. Cox with Bob Batcher here. We started that, really got into it this year, and really now starting to hit our groove on that one. And then the No Wrong Door Connectivity Project. No Wrong Doors is a database where as providers get on board, we can transfer information seamlessly. Referrals, you can follow referrals if I refer somebody for home health services, for example. I can confirm that that referral has been picked up or rejected, so I don't have to leave my client hanging. The other benefit to the program with permission, the universal assessment instrument that we all use to begin to outline what the needs are for the senior, we get filled out and can move forward to the next agency, so that the person doesn't have to go and say, fill out this long form again with the same information for the next organization. You can just imagine the frustration for a senior who's now on their fourth phone call, filling out the same information over the phone with the fourth person who's trying to understand the person that can't quite hear them. Our areas of focus: advocacy, as you guessed, affordable housing, transportation, awareness of the value and needs of seniors. That's one of my objectives this coming year is when I go back to those boards of supervisors, when I go back to those city councils, when I go back in front of the mayors or city managers, to be able to express to them, first, there's great value in your senior community. The resources that they bring, whether they're financial, mental, spiritual, are significant to your community. And you want to build as a manager, director, what have you, of your city, you need to recognize the value of these folks and make sure that you're building it up so you can take advantage of that. And then, what are the needs associated with that? What do they need to do in order to maximize the value of their senior populations? That's what I'm going to be communicating this year to those folks. And then finally, customer service. Internally, we have a real focus on what we call the SSSEVA experience. What can we do to serve the senior community most effectively and make them feel like they're part of our family? You can see from 2017 to 2020 our budget. You see a big jump here in 2019. That was an anomaly. Let me just put it that way. To be seen no more. This is our budget. And when I say it's flat, it's going 7.2, 7.2, 7.2. That's it. Really for the last 4 years. So where does our revenue come from? 59, almost 90% there is coming from federal and state resources. That's 2019 budget, 2020 budget, pretty much the same. Then from local jurisdictions, we get about 4 to 5%. From program revenue, we get about 3.7%. Is that what I'm looking at? 3.7%. Grants. Program revenue. Grants. About 1.4%. And it's going to be about the same, 1.4, 1.7%. So a small portion from grants. What I have seen in my first year here, as I've gone to the grant presentations, there's a large focus on children to the exclusion of seniors. It's not that it's bad that there's a focus on kids. Absolutely. I have 5 kids myself. Okay? Focus on the kids. But don't forget our seniors. There's a huge need. You saw the population statistics. The need's only growing. And we cannot exclude, forget, or neglect our seniors when we come to funding opportunities, whether it's federal, state, or local, or grants and gifts. How is the money dispersed? 30% of our funds go to transportation. 23% goes to the Center for Aging for our options counseling, benefits counseling, different services like that. Community-based long-term care, 20%. Wellness and lifestyle, 18%. I'm not sure what support is. Admin. Administrative support, 5%. So you can see we're really very lean in how we run our organization. Okay, now you know everything about Senior Services of Southeastern Virginia. You know a little bit, hopefully a little bit more about the community and the seniors at large. What are questions and or thoughts and ideas that you might have?
So we have a question on Facebook that came in a few minutes ago asking, who can help seniors with legal issues such as wills and powers of attorney?
Who can help seniors with legal issues like wills and power of attorney? We have a number of organizations that work for us, Virginia Legal Aid Society. The other ones get evading me right now, but you can call Senior Services and we can hook you up to those agencies directly, or we can connect you with other agencies if those don't apply to you.
Another answer is that a couple of times each year through the Norfolk Portsmouth Bar Association, we've started providing free wills clinics for seniors who qualify. So that's available through call.
Is there one coming up, or is
There's one
planned
coming
yet?
up in September, and we also, our Art of Healthy Aging Forum and Expo in November. On the 14th, we'll bring a wide variety of resources. There will be estate attorneys out there, long-term care attorneys, so we urge people to sign up and come out for that.
Good. Other questions?
Is that free?
The event, it's
Which one?
I mean to like have someone help
With
put
your
a
will?
will together, is that free?
for qualifying seniors. So for low-income seniors, it's free. If you come out to our event, there will be resources there where you can find out more and sign up to meet with someone to find out about the cost of putting it together. And if you call our resource specialists, they can connect you to some of our the long-term care attorneys that we work with on a regular basis who come out to our events. So we can't refer you to just one specifically, but we can say, here's people that come out and participate.
Bob, you have a question?
Great presentation. Is it available on your website?
It's available on Facebook.
But is the PowerPoint available on your?
I can provide that.
That'd be awesome, because
Sure.
it's a good, and I think you're working with the Greater Hampton Roads Coalition for Aging too, and the idea of having a strong message that is unified among the regions is going to be very important.
Yeah, what
So thank
Bob's
you.
referring to is the Greater Hampton Roads Task Force on Aging. Task Force on Aging, where the heads of the different task forces get together. We're really looking at making sure we're all talking about the growing population, the value of seniors, and the needs that are out there. So that when one of us goes in front of somebody, it's not the first time they've heard it. Wow, you know what? Margie was just talking about that. Bob was over there at this, and I saw a similar presentation. This must be real. So we want to get the general message to as many people as possible to start discussing the needs of seniors, the growing population, and the value that seniors bring to the communities.
Because Steve, I want to reinforce your point about the focus. Drew's not here, but you are. And I'm seeing it in this cycle of looking for grants where seniors have been referred to as niche, where even looking at the arts organizations are starting to cut the funds if it's things for youth or for adults, for senior adults, and not for the new millennial generation. So it's very subtle, but it's becoming very significant. Addressing the VA thing, and Katie's on the other line, but thanks to her direction and setting us in the direction of looking at having a fund source that would support us while we support vets in looking for payment. When you look at the agencies that are supporting vets, it's for education, it's for job training, it's for housing support, which means it's for the Afghan and the Iraq veteran. But when you start looking at our population that's looking at Vietnam and in Korea, there's nothing. So there's this subtle switch to a younger generation, and yet that Vietnam and Korea vet is with us probably for another 20 years. So what are we supposed to do in the next 20 years? So I reinforce you big time. So anybody that can help pass that awareness along, that, and even with the transportation, millennials are driving the message when it comes to HRT. But as I said to the HRT, when you take the license away from your mom, how's she gonna get around? And it's seniors, so you gotta say what you always say, because you're not in the room, I can't quote you. Design it for.
Right. So one of the things I told you, I'm working with numbers of livable community initiatives, and what we say is, if you design a community that's livable for a senior, you've designed a community that's livable for everybody. So it's not that every service has to be senior focused, but at the end of things, if you've really made it livable for all ages, it's livable for a senior.
So in response to Bob talking about that generation of Vietnam War veterans, Tanya is saying, check out Disabled American Veterans Charitable Services Trust Grants to help support funding for needs like that, and for our needs as we're looking for funding for the program.
Thank you.
And she was supportive in telling us
And we
that.
have
Thank you, Tanya.
I have a couple of other questions coming in through Facebook Live. One is, Many seniors live in food deserts. What help is available with this issue?
It's a really great question. It's a really big problem. As I said, I'm working with the food bank for Western Tidewater, talking about their mobile pantries. We're looking at Hayden becoming a mobile pantry as an example. Franklin is one of the biggest, vast food deserts there is in Hampton Roads. So that's an area of focus for both us and the food bank. So it gives us an opportunity to team together. We've recently met with all the churches, a wide variety of the churches out there who have food pantries and are trying to do good. And so we're going to be figuring out how we can team with them in order to help them succeed. If we can, like I said, if we can help people do good that they're trying to do, and we don't have to do everything, we'll meet those food deserts more directly.
All right, and another question on a completely different topic. What can a caregiver do if they need someone to watch their elderly parent with Alzheimer's while the caregiver goes to their own healthcare appointments?
Hello.
Brad, they'll take care, Bob.
And that's a good example, I think, where you brought up, there's providers out there. I always refer to it, there's a need, and then there's all these providers. Prime Plus, that's one of our core functions, is to provide respite care Monday through Friday during the day so the caregiver can have a life. Either work, play golf, go to the health appointments, go to Home Depot or whatever. So I would encourage them to contact us, and we have 2 locations in Norfolk and Virginia Beach. There are other services that are drop-off. The biggest issue I think we've got, you mentioned PACE. There are programs that are available for people with wealth. They have all kinds of options, the towers that are being built and all that. There are people who qualify for Medicaid and a variety of other programs. It's what I call the Oreo cookie. It's that cream in the middle of the people who don't qualify for that and can't afford it. And so that's the niche, and I use that word with great pride. That's the niche that we're hoping to be able to fill through active side, but also in an adult day service program. We're not a drop-in program, so you got to be registered, you have to have a UAI and all that. But I think to have knowing that caregivers know that those kinds of services are offered through you guys in referral, and then we can follow up.
Yeah, and sometimes folks don't recognize that with adult daycare, it doesn't have to be every single day, right? So you can get your respite on a regular basis, and we really try to promote caregivers taking care of themselves. So questions like that one is really important. Where can we go? What can we do? There's another opportunity for senior companions. If your senior qualifies for a senior companion, that person can come out for 2-3 hours, whatever's manageable that day, and then the caregiver can get out and do the things that they need to do. Brad?
I'd also encourage this person to call in and speak with our caregiver specialist. We have an identified staff member whose whole position is to work with caregivers regardless of what their loved one's diagnosis is. And this person can try to help you find, whether it's through us, some respite, through the Alzheimer's Association. So you would just call in to our resource specialist at our main number, and they can link you to our caregiver specialist.
Yes.
And another partial answer to that gal's question about what she can do so she can get to her own doctor's appointments. I don't know how it stands now because unfortunately Virginia Beach Care, respite care no longer exists. But you all used to fund us with a grant to do in-home respite. So if somebody isn't able to go out to daycare, Catholic Charities has now taken over the whole Hampton Roads area. And that's a wonderful resource for people who shouldn't be leaving their loved one alone, but need to take care of themselves.
Excellent. It's a really good example of everybody doesn't know all the resources that are available to them. And but we have another question.
And also, I promote the Alzheimer's Association. So 24 hours, the person can call, get any assistance they need through the Alzheimer's Association. Caregivers, resources, you name it, they have it.
Yeah, Alzheimer's Association here is very strong. It's a really nice organization. They're actually located right here in this building. And so they should be one of the primary resources for folks who, I think not just with Alzheimer's, but any kind of dementia that's going on, they can direct you directly to care we call them groups that get together, resources and folks, not folks.
Support groups.
Support groups, exactly, thank you.
All right, so we have another question regarding housing. Affordable housing is a problem in our communities. What resources does SSSEVA have to help a senior who's looking for affordable housing?
That's a tough one. Like, you know, Hayden Village Center is our first step into affordable senior housing. And like I said, it opens in September. It's only out in Franklin, though. Affordable housing is a significant issue, not just here in our community, but across the country. Anybody have any thoughts on that, Debbie?
So, and this is just because my office happens to be outside the desks of the resource specialist, so I'm hearing things all the time, which is a great learning opportunity. And I hear them talking to people about this on a regular basis, and while they can provide them with access to the housing lists that are available, what I'm always hearing, and it's good for our legislators, representatives to hear, is that there's not enough available over and over, and it's like you're getting on waiting lists. So while we can direct you to those waiting lists, there's just not enough, as Steve is saying.
Suzanne?
I think that from the standpoint of this being a public hearing and meeting has been really beneficial, hopefully for you all as you build your plan. Because it's been clear that I think a couple of things have emerged here. One is this really significant role for SSSEVA as that one-stop shop, that systems navigation, that, you know, as we kind of tried to help folks find legal services, as we've helped veterans, as we've helped, you know, respite care. I mean, that's just 3 or 4 questions in 10 minutes that you all were able to take care of. And so to the extent that more and more people in the community become, you know, that becomes embedded in the community culture and people's psyche, oh, call senior services, you know, then that's an important part of your mission and fulfills your vision. Challenge for you to make sure you've got capacity to do that, but that's it. I think the other piece of things that we heard today is your really significant role in advocacy, whether that's sensitivity advocacy to local governments to say seniors are a value in your community, whether that's policy and funding advocacy at higher levels, whether it's advocacy around specific needs like affordable housing, which, you know, you're not going to be able to build enough affordable housing, but you can advocate to make sure that people continue to understand that seniors need affordable housing. So, you know, and that those things can be prioritized over 3 years. So I think that, you know, as a Service Advisory Council member, and feel free to, you know, give me a nudge. You know, I think you've got some really wonderful input and feedback here to help reinforce your area plan.
Okay.
Hi, Tanya.
Yeah, she says hello.
It is 2 o'clock, so I want to be faithful to our time. I want to thank everybody for coming out, thank everybody on Facebook Live. You can still Facebook or email us suggestions, ideas, questions for the next few days. Our area plan needs to be approved on July 26th, or submitted on July 26th. So we have a number of steps we have to go through yet to get it approved by our Service Advisory Council, our Strategic Planning Committee, and our board. And that's all going to happen in the next couple of weeks. So if you have other ideas, and certainly if you have other questions that we didn't get to answer today, go ahead and let us know and we'll get you the answers.
And I will weigh in, besides directly contacting Steve or myself, our area plan survey is available on our website.
Okay, thank you so much.
Thank you.